Nicole is the Chief Program Officer for Caring Across Generations. Prior to her current roles, Nicole was Senior Director of Public Policy and Senior Executive Officer of the State, the ARC at the State ARC. The ARC of the United States. Blah. Nicole has been the CEO and President of the Institute of Public Policy for People with Disabilities, and also an accomplished special education attorney. Nicole leads and supports many coalitions to advance the priorities of the CARE movement, including strengthening and expanding access to Medicaid, home and community-based care, better pay for direct care workers. Nicole is most importantly a sibling to her brother Chris, who is 35 and has autism. Please help me welcome Nicole warmly.
Hi, everybody. Thank you for that kind introduction, and always good to hear from Sean, and I am very lucky to know all three of these gentlemen, and humbled to follow them, but glad to be here today to talk about the politics of disability, some of the history, and the importance of coalition work in advancing the needs of people with disabilities. A little bit more about my story. My brother Chris is right there in the middle. As Stacy said, he's 35 and has autism. He's also a much better advocate than I am. If he would get on a plane, I would have brought him with me. And he's been doing a lot of work with me, pretty much I eat, sleep, and breathe Medicaid lately. And that has been true the bulk of my career. But I want to start with a quote from him about what Medicaid means in his life. He wrote recently, we did a big town hall with a few thousand people, and he wrote that Medicaid gives my life color. Today, it meant being out in the community with my niece, nephew, and care worker. Every day, it means freedom. And that's what we're here about. And that's what that freedom for people with disabilities is also directly connected to so many other constituencies and members of communities. Some of those are also some of the other photos, which I'm very lucky to be older and still have 3 of my 4 grandparents. And something that I've learned in my work in DC and also at the state level when it comes to disability is that disability and aging shouldn't be warring factions, and too often they are. And something that if you're working, as an example, in a state that's working on a master plan on aging, why doesn't include disability? That's like, a lot of people in a lot of states have heard me say that very loudly. Because the reality is that for family caregivers, for aging adults, and for people with disabilities, so many of the solutions are connected and so many of the solutions are the same. At Caring Across, we have data that shows that 95% of people with disabilities want to be living at home and in their communities, and AARP has data that shows that 90% of older adults want to be there. And so the more we can combine forces to make that happen, because that's not what the funding looks like. You all know that as you're working on budgets, 95% of the money is not going to home and community-based care. And so my own personal experience is part of why I've always been driven, obviously centering disability rights and justice in my work, but making sure that I've been able to bring that into other spaces and other constituencies that weren't necessarily thinking about disability. Another place where there's sometimes can be more tension than not is I like to say that the tension between aging, disability, and labor is where I've built my career. We're very lucky to have very strong labor partners, and I also am a senior advisor for the national, for NADSP, the National Association for Direct Support Professionals, which is direct support professionals are the specific workforce that work with people with DD. And that's my friend, Reverend Harriet, who is a home care worker in Michigan and in Georgia. And one of the things that I have learned is that we have to also make sure that whether we're talking about aging or we're talking about disability, that we're also bringing along the workforce. Because there's been a lot of points in history where advances were being done for labor, but it didn't take into account the fact that those advances would mean less hours for services for people with disabilities, as an example. So all of those pieces are really core to the coalition work that I'm going to be talking about. And I'm going to speed through some of this because you all just heard from much more people that are much better to talk about this than me. But it really is important, I think, when we're talking about beginning with the end in mind and thinking about the system that we want to create for all people with disabilities in our states, we have to also remember how far we've come. It used to just, as Sean so eloquently stated, it used to be that people with disabilities were sent away or were seen as charity, and now we've moved and people with disabilities were forced into dependencies, other people were speaking for them, labeling them, and now, it's almost, we didn't even plan it, Sean, but now we have a new vision, which really is nothing about us without us. We've moved from families, which families play a very important role, obviously, I feel that as a family caregiver, but the reality is that the early history of the disability rights movement was families speaking on behalf of their kids. And that was important, and I'm gonna go through some seminal pieces of legislation, but that was important because those same families that did keep their kids at home were then saying, well, we're not just gonna have them sit here, we need to have them in schools. We need to have them in the community. But then we saw the shift from parent advocacy to self-advocacy, which is so incredibly important. We saw the birth of the independent living movement and really the assurance that equal access is an important thing for every community, but that we have to be centering and lifting up leaders who are disabled. There has been a massive struggle to gain full citizenship and a seat at the table. We know that integration is an ongoing battle. We're coming up this month. It marks the 26th anniversary of the Supreme Court decision, Olmstead. You might be familiar with Olmstead plans in your state. I have a lot to say about those, but I won't do that here. They're only as effective as you make them. The Supreme Court decision was a decision that people with disabilities have a right to live in their homes and community if they choose, but that hinges on the state finances and federal finances. And that's why we've never seen the true promise of Olmstead come to light. We still have 35 states, including my home state of Illinois, that have institutions. That is not where people want to live. I just went through the data, but that's also where a lot of money is going. And in order to really make that shift, we have to start talking about, in order to meet, I actually have integrate tattooed on my arm, because the word integrate means to make, the Latin root of it is integrare, which means to make whole. And when you think about all of the folks that were just on the panel before me, when I think about my brother Chris, our family, our community would not be whole without him. But we haven't put our money where our mouth is to prove that that's true. And that's something that's really important. We're right now in a defensive stance, but we're gonna get back into investing because these are really popular issues across party lines. We need to, again, and this is to Sean's point too, we need to have policies by people with disabilities and not policies for. And that's also true across coalition. It's really easy, actually, that tension I mentioned between those groups, that's amongst advocacy organizations. When you actually get a person with a disability and a direct care worker and an aging adult in a room, that tension doesn't exist, right? So we also have to make sure that we're lifting up people and not just groups that are representing them. I'm gonna go through a few, and these are, everybody knows these likely, but I just think it's really important to think about the history of the big pieces, and I'm not gonna go through every piece of legislation that impacts people with disabilities because we'd be here, and I'm gonna get you out in time for break. But we have the Social Security Act. Social Security plays an incredibly important role in the financial security for people with disabilities. And in 1965, we're coming up on the 60th birthday, 60th anniversary of Medicaid. Medicaid and Medicare. Medicaid and Medicare were created in law in 1965. And people with disabilities were an original population that was meant to be supported by Medicaid. That's incredibly important because we know that there's a lot of proposed cuts to those programs. And so that's also people with disabilities, while they make up only about 20% of people, the Medicaid population, they account for about 45% of the spending because long-term care is expensive, because we want it to be long-term care, because that means people are living long and full lives. And that's why the cuts and the impact would have an outsized impact on the disability community, particularly because of, I'm going to switch to this one and I'll go back to education. Then in 1981, under President Reagan, that's when home and community-based services were created. It's probably hard to believe that it was only 44 years ago that people had access to home and community-based services, but it was the Katie Beckett waiver in 1981 that created that, because before that, whether you were a kid or an adult, your only option for funded services was institutional-based care. So 44 years ago in 1981, home and community-based services funding stream was created, but when it was created, it wasn't put on equal footing as institutional care. Home and community-based services were created as an optional service under the law. And so far, and nothing in the current proposals do anything to change that, which means when you see massive cuts, and I'm sure you're all thinking about this as legislators, because when you see massive cuts, mandatory services have to continue. Prescription drugs, institutional-based care, hospital visits, those things have to continue. There will not be an option for states of where to cut. So people with disabilities use a lot of Medicaid, as they should, and then the most important place where they're receiving services are most at risk, which is why the disability community is and has to continue being loud. We stopped it in 2017. I'll go into that a little bit more later. I was at the ARC then, and I think we can do it again, because it really, once you actually ask people, no matter their party affiliation, no matter where they live, they do not support cutting services for people with disabilities. But we have to make sure that the connection between that and Medicaid is clear. Another place that is incredibly important was the creation of what is now the Individuals with Disabilities Education Act in 1975. Before then, students with disabilities didn't have a right to be in their public education setting. I was a special education attorney for about 5 years after law school before I went into the policy side, and the right to a free and appropriate public education does not come without a fight in many places. And so it's really important for students with disabilities to be in their least restrictive environment, but sometimes that can cost money. Not sometimes, almost always it costs money. And so it's a really important piece that is also, unfortunately, right now, because of some of the proposals at the federal level, there's a lot of concerns about, even though the federal government has never put up all of the money that they were supposed to for education, they still put up a lot, and any cut to that would greatly impact students with disabilities. This is another some could say most important piece of legislation is the Americans with Disabilities Act. That was, it's a big anniversary summer. You're gonna see a lot of action in DC because of that in July, because in July you have the Medicaid and Medicare anniversary on July 30th, and you have the ADA 35th anniversary on July 26th. This image is from the Capitol Crawl, which our friends at National Adapt led. And that's where you had people with disabilities, people who use wheelchairs, and actually a lot of children crawling up the steps of the Capitol to physically show that they didn't have access to power and access to a lot of buildings as well. The Americans with Disabilities Act is a seminal piece of civil rights legislation. It's also really important that people realize that it is actually a piece of civil rights law. How that comes through is the Olmstead decision that was decided. That was a decision based on the Americans with Disabilities Act that held, actually I can use the legal term, that held that people have a civil right to life in the community, but then they added that money clause. It also, the ADA makes it illegal to discriminate against anyone based on their disability in the area of employment, public services, transportation, public accommodations, and telecommunications. A lot of people obviously know a lot about physical access, but again, it's also that access to the community. I was a court monitor just down south in Oregon. Around the state of Oregon had a settlement with the Department of Justice based on Olmstead, based on the Americans with Disabilities Act to close their sheltered workshops, to close the segregated employment settings that they still had. Proud to say that they were successful in doing that. We ended the case in 2022. But that's the type of enforcement that's still happening. Even though this law is 35 years old, that enforcement is so incredibly important. That enforcement also has been out there as states have shifted away from institutional-based care. One thing I also want to mention before the Americans with Disabilities Act, the Affordable Care Act is also incredibly important to people with disabilities in a way that a lot of people don't necessarily think about, because before that, there could be lifetime caps on services. Before that, a disability could have been considered a pre-existing condition to care. So the ADA is an incredibly important piece of civil rights legislation, and so is the Affordable Care Act for people with disabilities. Any questions? I just ran through a lot. I realized I was talking fast because I'm trying to get to 3. Okay. The politics of disability. Disability doesn't discriminate. It could happen. Any of us could be a member of the disability community at any moment. And disability issues are nonpartisan. As I mentioned, it was Ronald Reagan who, under his presidency, created the home and community-based service system that's so incredibly important. Policy advancements have occurred at state levels and at the national level under both parties. Policy arguments may vary, I will say, as someone who's lobbied in Congress for a decade. The arguments you make about why to support a piece of legislation might be different, but you can still get people to yes, no matter what the political leanings and backgrounds. For some offices, a rights-based argument is going to be all that you need. For others, it is going to be, and Sean, I'm really glad I got to hear you because you set me up really well, teed it up really well, because institutional-based care, other care is incredibly expensive. So for some, the fiscally based argument is going to be the most effective. We have really strong longitudinal data around the savings from community-based care. The Money Follows the Person program is actually 20 years old. It was in 2005. That's the thing I've lobbied on the longest. So, but the Money Follows the Person program has very clear data that shows that for people who choose to move out of facility-based care, the Money Follows the Person program, is anyone familiar with it? Oh, I love to hear it, yay. But it shows that because Money Follows the Person creates some flexibilities, because sometimes what's the hardest thing about moving someone who wants to out of a facility and into the community is things like Medicaid is not allowed to pay for room and board. Although that's something we should argue, because obviously nursing home is room and board, but I digress, that's another conversation. And so Money Follows the Person includes flexibilities to pay things like the first and last month's rent, security deposit, that sort of thing, because so often that's honestly all it is before someone can get out. And we have data that shows 20% savings per Medicaid beneficiary per month for folks that move out of a facility and into community-based care. So there is savings, and again, those fiscal arguments can be the most moving, and that's true at the state and at the federal level. Disability is part of every community, it's part of every issue, which is why coalitions. Coalition work is some of the most important work that I have done, that I'm lucky to do every day. And it's really important, I think a lot of disability groups, because every issue is a disability issue, feels like we have to take it on ourselves. As Stacey mentioned, I was at the ARC of the United States for about 7 years, and we worked a lot in coalition, but we often worked a lot in coalition only with other disability organizations. And that was important, and we were able to achieve a lot, but it's also really important that people with disabilities and people who care about people with disabilities are bringing disability issues into other movements. I'm now at Caring Across Generations. I have been for almost 4 years, which is hard to believe. And frankly, when I shifted into that role and into that work, it was hard for me, because I was not going to be only doing disability work. And care has also historically been a really complicated word for the disability community. I'm happy to say I think we've moved through a lot of that. But care and caregiver used to be seen as like taboo language for people with disabilities because if you don't use it right, you can take away the agency and autonomy of the individual who's receiving care. And so it is really important to, when we're talking about care generally, that we're doing that. But it's also really important that we're showing in this bigger group of people, which at Caring Across Generations, we call it the caring majority, that people with disabilities are centered as people who need care, but also a lot of people with disabilities are also caregivers themselves. We have data from RAND that shows that there are 105 million people who are currently unpaid family caregivers. That's 40% of us. Yeah. The interesting thing is a lot of people don't realize that they are caregivers, I will say. I was just at an event down in Hollywood last night because our organization does a lot of work in Hollywood and around culture change. And I sat in the room and someone was like, well, just kind of like schedule all their appointments and make sure that they have food, but I'm not a caregiver. And then I sat there and waited, and then they the aha moment happens. And that's really important because we have data that shows that 30% of parents don't identify as caregivers. I'm not in this room, I'm not in any room trying to convince everybody to see themselves as a caregiver, but it is important when we're creating these solutions and when we're talking about policy areas that need massive investments and massive solutions, that we're talking about a huge amount of people and a huge amount of people who are providing a lot of unpaid care. The National Partnership on Women and Families has data that shows that $1 trillion of unpaid care is going to the economy from family caregivers. That's where it's showing up. Again, these are some of the fiscal arguments that can sometimes help because there are so many family caregivers who are giving up their own retirement security and financial security because of the systems that we do not have. And so this is some of the folks that we think about. We're talking within the care movement. We're talking about family caregivers. We're talking about people with disabilities who need care. We're talking about aging adults. And we're also talking about the fourth leg of the very important stool, the care workers. Because we know that without care can only be a choice if we have a strong and well-paid care workforce. We're not quite there. We have a long way to go in terms of making sure that people who are providing care to our loved ones are actually paid a family-sustaining wage. And that's because of the historic undervaluing of people who need care and the people providing it. Care workers are predominantly women of color, predominantly immigrant women. Because of the makeup of the workforce and the historic societal lack of value that society has placed on people with disabilities and aging adults, this has been an issue that we're beyond catastrophic point when it comes to the direct care workforce. So that's why within Care Can't Wait, which is what I'm going to talk about, we have all of these different groups, and don't need to read them all. But this was when I was still at the ARC of the United States. A lot of groups that were working across childcare, paid leave, home and community-based services, and direct care worker rights and advocacy came together and said, what if we stopped fighting for scraps? What if we stopped pitting ourselves against each other to fight for these things and instead came together to fight for the solutions, all of the what we call the pillars of care that everybody needs. And so the Care Can't Wait table was born. We're still very active and working very hard. And again, this kind of lays out all the different groups that we're talking about. You'll see, obviously, disability justice is very centered. We have racial justice groups, we have gender justice groups, we have economic justice groups, because when it comes to disability and when it comes to care, it is a disability justice issue, it is an economic justice issue, and it is a racial justice issue. So this is our logo that actually needs an update, but we are a coalition that's based on working to secure investments in care. We worked very hard around the American Rescue Plan Act that did include some continuation of tax credits on paid leave, but it did include investments in childcare, and most importantly, almost $40 billion in temporary funding for expanding access to home and community-based services for people with disabilities and older adults, and for addressing the workforce. So this is what I'm talking about when we're talking about a strong care infrastructure. We came out with a paper in 2020 about the fact that when we need, and former Senator Bob Casey was really strong at talking about this. Some people need a road or a bridge to get to work, and some people need a care worker. And that's the reality, is that care is infrastructure. Care is also our next iteration is around the care economy, because we do know how much care is an economic imperative for people who need care and for people who are providing it. Care is kind of the broader movement, and I also co-chair at the national level the Disability and Aging Collaborative. The Disability and Aging Collaborative started in 2009 when the Affordable Care Act was coming together. It includes groups from AARP to the ARC to SEIU, so again, that labor, disability, aging space. It includes lots of disability-led organizations as well, NICOL, the National Council on Independent Living Centers, SABE. A lot of those groups are a part of the Disability and Aging Collaborative. And we're very busy right now because of everything that's going on at the federal level. We just actually submitted, and hopefully folks have seen it, and I'll make sure Stacy has it and we can send it around. But we, along with the Consortium for Constituents with Disabilities, which is another national coalition of groups, just sent up a letter against the cuts to Medicaid that had 1,100 groups on it, and that included groups from every single state. And so we have been really focused on not just bringing national groups together, but we've also created this Protect Medicaid space that we're holding every 2 weeks, where we have state groups getting the exact same information that national groups have at the same time. And it also has allowed for a lot better coordination, a lot better coordination than what we had in 2017. I mentioned 2017 earlier because it was the last time that we faced these massive cuts to Medicaid. Literally, it's almost the same dollar amount that we're facing. It's just a different mechanism. And we were successful in fighting against it. And people with disabilities the disability community is still named as one of the reasons that we still have Medicaid in the Affordable Care Act. Our friends at National Adapt staged a die-in over the summer of 2017, and that I was very lucky to be there as a media verifier. I got to kind of be the Paul Revere and go to the rotunda and be like, hey, you might want to go down to McConnell's office. But it really helped shift the conversation, because at that point, all that anyone was talking about were traditional healthcare, which is important, but nobody was talking about home and community-based services. Nobody was talking about how this would impact people with disabilities. And again, as I mentioned earlier, it would have an outsized impact on people with disabilities. Medicaid, I think we've seen this more this year than in 2017, and that's intentional, and we've been leading it, so I hope that people are seeing it, because Medicaid is and can be a bridge with groups working in other areas, when working on other issues. Again, racial justice, gender justice, all of those things, because, and I won't go through all of my talking points on Medicaid right now, but it covers 40% of the births. It covers, I said it and then I'm doing it, but it covers 1/3 of child care workers. I just got data as I was sitting waiting to speak that direct care workers are the highest percentage of people who are on Medicaid themselves for their health care. So again, it's this intersectional issue, and it can be a bridge. So we're planning big actions with groups that we were not working with in 2017. Groups that are focused on women's health, groups that are focused on faith-based groups. We've expanded our tent, and that's the thing that I've learned as I've shifted out of the disability community and into the broader space, is that we can still center disability while making the table bigger. At this point, our goal is to defend a far from perfect program, to build power for the future systems that we want to see. again, I guess I got ahead of myself, but Medicaid is a connector on so many issues. It's a health issue for patient advocacy groups. Rural hospitals are going to be greatly impacted. I'm sure all of you who are state legislators, I'm very sure, because I'm directing people there, are hearing from people about their concerns about all of these issues. It really is something that's going to impact everyone, which is why we have to fight against it. But again, we can't just end on defense. I think that's some of what the lessons that I've learned from 2017 is we did do some things after to make sure that some of the bigger healthcare proposals included some pieces, but we didn't do enough to as we were defending, to talk about what's next. And I think that's also the value of coalition work, is you can walk and chew gum at the same time. There can be a set of folks that are really focused on the Hill. There can be in DC or in the state legislature, wherever you are. But there can also be a group that's focused on mobilizing. There can also be a group that's focused on the communications piece. And what we're really thinking about, obviously we've been doing a lot, so these are some photos of different actions that we've done around the Medicaid fight in the last few months. As you'll see, these are big cross sections of groups. There are legislators only of one party, but not because we don't invite everyone. And again, highlighting all the different populations that are going to be impacted. We also did a 24-hour vigil in May. I was there the whole time. I'm still tired. The last time I did that was 2021. 4 years makes a big difference. But we came together and for 24 hours bore witness to all of the different types of folks that would be impacted by Medicaid cuts. And yes, centered people with disabilities. We had ADAPT there. We had the Disability Rights Education Fund, the ARC. A lot of disability groups were there. But again, along with labor unions, along with women's health groups. And it was really powerful, so much so that, breaking news, we're going to do a 60-hour one in July for the 60th anniversary of Medicaid and Medicare. I'm not staying for the whole one, but I'll be there a lot. One thing, and this presentation is not just about Medicaid, but Medicaid is obviously so centered right now in the disability fight. And this is, so I have polling data on Medicaid, but I can also tell you that this polling data is also very similar. If you look at any person from any locality around support for people with disabilities, 82% of adults, including 67% of Republicans, oppose cuts to Medicaid spending. 77% of adults hold a favorable view of Medicaid. That's not how it was when I started in this field. We're almost at this on par with Medicare, which was not true. And that's really important. And 66% of adults say that they have a family member or a close friend who have been covered by Medicaid. And that shows the level of education that has improved. As you all, I'm sure, know better than me, Medicaid is called something different in every state. As someone who's working at the national level, that makes it really complicated. And I'm sure it makes it really complicated for you all too. But when you break down these issues across the board, it is unpopular. And the thing that we need to do, and we just did polling about who knows what's in the bill that's currently moving through Congress. And actually 56% of people knew that there were Medicaid cuts in the bill, which isn't enough. We still have a lot of education to do, but only 44% of people knew that there were cuts to services for people with disabilities. That shows how much we need to elevate the disability issue within the conversation. And I think if you're looking at any issue, whether it's employment, the disability issue needs to be raised and needs to be centered more, because the more people understand that, the more that they oppose it, or the more that they support putting more money into it. So again, we want to shift from defense to offense. We want to protect programs, but then also make sure that we are building towards the future. These are far from perfect programs. They're older. Sometimes we need to modernize things, but we can't modernize them when there's threats. Disability groups need to work collectively with groups that are not thinking about disability. because then you have allies to turn to in the fight. All issues are disability issues, and people with disabilities have diverse viewpoints, and therefore we also need to have diverse policy solutions and need to make sure that we are not being transactional in our work with people with disabilities. That's something that I've learned, and I've had to be really focused on in my work in the care space, is because not everybody does understand how to work with people with disabilities in a way that's not transactional. And that's something that I think that's my last slide. So I'll close with that because I think it's really important. People are more than their stories. We need to be highlighting those stories, but then also bringing people into the conversation, and not just asking someone to share their trauma and their hardship, but then to be asking them to come in for the solution. And that's what I think that we can continue to do. I think that we've grown in that in our care work, but it's something that there's always room to grow. I will stop there, but happy to answer any questions, and just really appreciate Stacy and everyone who put this event together. I think it's so incredibly important that you all are here, and if there's anything I can ever personally do, I'm always here, but happy to answer any questions.
All right. Thank you, Nicole. Who has questions for Nicole? I got some eye contact over here.
Just to let you know a little bit of what's going on in Georgia as a kind of warning to what's happening on the federal level. Georgia is one of the states that has not expanded Medicaid. Except for this teeny tiny little expansion they did fairly recently, which is expanding it up to 100% of the federal poverty level, but making a work requirement. 80 hours a month. You can get that by working your traditional job, going to school, or volunteering. But guess what? Caretaking does not count. Mm-hmm. I tried to raise the awareness of this starting last November. All I could do to get our governor to budge was to submit for a change to have caretakers of children under 6 included. The rest of the caretakers, I guess he didn't care. Mm-hmm. So let's hope that if we get work requirements at the federal level, and let's hope we don't, but if we do, let's make sure that caretakers are covered under work.
And currently caregivers are not exempted out of the bill. And also, I know a lot about Georgia's program, and so I can spew some data that I have memorized, which is that they spent $86 million to cover 6,000 people at an 84% administrative cost. That sounds like waste, fraud, and abuse to me. I don't know. Anyway, other questions?
More questions for Nicole?
Yeah, it's all up here somewhere.
Anybody else have questions for Nicole? Okay.
Thank you
Let's
all.
Give her a big round of applause. Thank you, Nicole. I'm so grateful. Here, I don't want you to leave.